Welcome to Elevated Practice, where we interview masters and mavericks within the field of holistic medicine and uncover unconventional stories in the field of health and wellness. I'm your host, Gretchen Badami, and every episode I'll be interviewing clinicians, scholars, entrepreneurs, and educators who share their wisdom and ideas with you. Are you ready to elevate your practice? Let's begin today's episode. I'd like to extend a big thank you to Handcraft Health for sponsoring Elevated Practice and empowering integrative healthcare practitioners to create personalized healthcare packages for their patients. Create a free account today and elevate your practice at www.handcraft.health. And now, on to today's episode. Today, we're here with clinician, educator, and entrepreneur Moshe Heller. Moshe has been practicing Chinese medicine for the past 3 decades, during which time he has also been teaching in colleges across the U.S. and Israel, and is a former dean of Pacific College, New York. Moshe is an international lecturer presenting at a variety of symposiums throughout Europe, Israel, and the U.S. He did postgraduate work in Beijing, China, focusing on internal medicine and gynecology, and he has conducted pioneering research on the effectiveness of acupuncture during labor. Moshe currently maintains a robust practice in New York City. Thank you for joining us here today in the studio, Moshe.
Thank you, Gretchen. Yeah.
I am so excited to speak with you about your history and your background and the current projects that you are doing within your practice as a clinician, a teacher, and entrepreneur. Can our listeners hear a little bit more about your background and your history, how you came to this medicine and began practicing and teaching?
So the history starts at the end of the 80s, where I came across a school in Israel of Chinese medicine and started studying there. And quite quickly, I realized I wanted to get closer to get exposure to people who have a little more experience, and did some research. And in that time, no internet, right? Everything is by mail. Eventually, I found Pacific College in San Diego, and what attracted me is that at that time, Ted Kapchik was teaching there, and I started reading The Web That Has No Weaver, and so I said, that's a good opportunity right there. I then transferred, into Pacific and graduated from there. I was very lucky to learn with quite amazing teachers. Alex Tiberi was one of my mentors, and he introduced pediatrics, Chinese pediatrics, to me, and that's how I got enthusiastic about this branch of Chinese medicine. I had other very great teachers, Zev Rosenberg, who's still teaching and writing books and very prolific and quite amazing. And of course, Ted Kapchik, who taught me for a very short period of time. So I was able to have one semester with him. And then he moved to Boston, where he's still doing
You were
research.
able to learn from all of these formidable scholars who now their books are the standards for our education. That's amazing.
Yeah, so I was very fortunate in that way. Once I graduated, I actually returned to Israel. And at that time, there was quite a boom in Chinese medicine in Israel. Quite extraordinary. When I went back to teach, there were over 1,000 students in the school at that time. It was quite big, and they were really looking for teachers. Since that school that I'm referring to was the sister school of Pacific, I moved from California back to Israel straight into the teaching position and at that school. And I had a practice in teaching for a few years. Pacific San Diego opened another campus before they even opened the Chicago campus. In New York, in 98, I was in a Pacific symposium and spoke to Jack Miller at the time, and he suggested that I come and do some administrative work and teaching. So that's how I ended up in Pecan, New York.
What a fantastic opportunity to move from being an educator and clinician to then being an administrator, opening up a new school. And from what I understand, and I'd love to hear more about this, once you became the dean there in New York, you were able to have a very unique opportunity with a local New York hospital conducting some research there. Can you
Yeah,
talk a
so
little bit about that?
Yeah, so I knew a doctor who worked at Lutheran, who developed this idea of doing research, and he was the chief investigator in a pilot study. And he connected me into the study, and they were looking for acupuncturists to perform the protocol and get the feedback and etc. So I joined that, and pretty quickly I realized that it would be a great opportunity for students to actually come in and have that experience. And it was a little tricky because there's a requirement when you open externships that there's a certain number of students that need to come and operate. And it was very tricky because there's only so many students that can go in a delivery room with a practitioner. In the end, we had two students come with me, and the shift started somewhere in the afternoon, but we never knew when they will end, because if you start a delivery, you have to stay until it's done. So we had some really long nights.
Not your typical externship that lasts for 4 hours per se, huh?
Exactly.
And what did you learn during this time? You said it was a pilot study, so it wasn't necessarily formalized research, but how did you find that acupuncture was able to aid in the process of labor? What unfolded for you during this time that you were able to be in labor and delivery?
So, other than the data that was collected, my personal experience, talking to the students and the participants, um, we saw amazing things. We could see that when we insert the needles, it affects the contractions, because most of the women were connected to monitors. And we would ask about the pain and how the pain is reduced by doing the simple protocol. And it was ear needles and a few body needles. So it was quite an amazing experience to see how things are reacting in the moment. We see that when we're working, especially with pain. You ask them how they feel now, and before and after, and you get some feedback. But when you see the monitor, you see how the contractions are coming up or coming down, and their strength, and then also there is some kind of visual perspective to it. I think that was an amazing experience to see.
And to be able to attend multiple births during this time period in the hospital as well, where the women were being monitored so you could get direct feedback. I'm sure there are a lot of practitioners out there who maybe are licensed and also function as doulas or do participate within births and have had some individual experiences using acupuncture during labor. But your experience of specifically being called in to assist during this time and being able to bring the students and be in a hospital setting was a very unique, valuable experience. Thank you for sharing that. I also wonder if you feel like something like that would be able to be replicated in this day and age. It seems to me that there would nowadays be so much red tape involved with doing something like that. I wonder if back in the late 90s that was easier to get through the door doing that than you would be now.
I mean, there were issues there, and also especially insurance, when malpractice insurance had to be adjusted. So there are technical issues, and at that time, Lutheran was really pioneering in that sense. And although I had some other experiences in other hospitals where I was able to do private deliveries, and I had quite an experience with that too. I think overall you have to adjust your practice to do births. It's very difficult, and it's the same with doulas, and I see the same with doulas and midwives. Births are just so unpredictable and difficult to manage, because how can you schedule something? The schedule is not even possible. You need to somehow adjust the practice, and eventually I realized that as a individual practitioner, it's very hard to maintain a delivery support system. I had a few options, either to build something that you have multiple practitioners that can take over at certain times, and that you build that kind of structure, or not, basically. Yeah. So eventually I chose to stay more in my own practice and do some support before and after, rather than be in the process.
Yes. But what a fantastic learning experience for you to be able to see what our medicine can do. And so now you've had this experience working in the hospital with labor and delivery. You had wonderful mentors such as Alex Tabiri, who taught you about pediatrics. And then you have your family practice and family medicine. Over the past 30 years, you have grown that family practice to have some subspecialties with fertility and treating both prepartum and postpartum. And then the ultimate outcome of those births, which was a pediatrics practice. Can you tell me what your practice looks like now with those specialties?
So it is a family practice. I would say that two main things that I'm seeing is pediatric patients and pregnancy and fertility issues. Of course, since I'm a family practice, always have referrals, and I treat all kinds of family things from old to young. And I like that kind of variety in my practice. It's quite exciting, I think, to get that wide range. There's definitely a beauty into specializing and doing things in a very specific group of patients. And I'll have days where I see mostly pregnancy patients, and then I'll have days where I'll see mostly kids, and sometimes a mixture. And that's something I enjoy.
This brings me to one of the big topics that we wanted to talk about today, which is you are now not only a clinician and an educator, but you have now become a bit of an entrepreneur, not just prescribing herbs from your clinic, but creating a line of herbal medicine that has some unique attributes to it for treating lots of different things, including fertility and pediatrics. But you've developed a line of herbs that have a unique way of taking them. Can you tell us a little bit about what brought you to decide that you wanted to create your own formulas and your own line? And then we can talk a little bit about what makes them special.
In 2016, I opened the Jingsheng Pediatrics certificate course for the first time with Dr. Stephen Cowan, and we had a cohort, and it was a really nice group. And I saw a lot of female practitioners who were in that cohort and dealing with children and various things. And somewhere in 2000, I think it was 2018 or 19, where in New York, there was a measles scare. It was called a measles outbreak, but really it was a scare, because I think there were only 3 or 4 cases in the end that were verified. But it created a big scare in terms of vaccinations and vaccinating kids. And I live in an area where there's a large community which don't vaccinate. And so they were forced to vaccinate really quickly because suddenly the institution required more strict look at the vaccinations, and we looked at schools who were not as controlling, and so that created a lot of pressure on parents to vaccinate kids and on practitioners who were, confronted with these, or the parents came to them to say what to do and how to do that.
Yeah. How to
And I was
support them
working
through that.
with Stephen at the time, and by the way, this idea came. My previous teacher, Alex Tiberi, was always discussing or talking with me that when kids should be vaccinated, the formula that we should think of giving them before and after vaccination is Shui Baidusanai. And so I took that concept and idea and developed a formula that will support children through the vaccination process. And together with Stephen Cowan, we created the guide to practitioners to support kids going through vaccinations, what to look for, how to prepare, what to do. And one of the steps was to give this formula that was based on Shui by Dusan, and that will support and prevent some of the issues going through vaccinations and strengthen the upright at the same time. Because part of the problem with Shui is that it is a little cold and hard on the spleen, and kids, you have to support their spleen too. So I changed the formula a little bit appropriately. And so now we have this formula, and we want to make it available for everyone and to practitioners. And then I had the idea that we need to create a line. So maybe there's more formulas that we can develop, and that's how this whole idea came of creating a herbal line to and start distributing it. So the idea that came with that is that we need to make it available for practitioners that different kinds of formulas that maybe don't need so much differentiation, because at the hallmark of Chinese medicine is pattern differentiation.
Right.
And so that would be the utmost way to tailor the formula according to your patient, and it's great. But in reality, there's lots of acupuncturists who have no herbal knowledge, but they have a sense. And so I wanted to create these patent formulas that will be easily accessible to a wide variety of practitioners, whether they have herbal understanding or not. But they can, even if you don't have herbal understanding, you can still do basic pattern differentiation and understanding of the basic concepts that you're trying to apply.
And of course, we set the bar high, saying that, of course, every patient must have a customized formulation, and this is the gold standard for our medicine. But right, in reality, there could be many reasons why a practitioner may not be able to do a custom formula for a patient, or may not have the ability to know how to create a custom formula. So you've been able to create some formulations that fit certain treatments for certain patterns.
So, for example, the formula that we're talking about, the vaccination formula, is called GUARD, sort of like guarding the child at the process of vaccination. And GUARD, so that was one of the first formulas I created for that. And then I thought there's a few main things that I would do, which pertain to pediatrics. One is sort of like a digestive formula. So I base it on Bao He Wan, and sort of modified it again, and we call it Digest. Which is a digestive formula for children for a wide variety of issues around digestion. And then I had one that's called Shield, which was really very, very popular during the pandemic, which is based on Yuping Feng San, with some more variations. So these are just some of the examples of the formulas. The first time I opened the herbal line was 2019. And of course, by 2020, we had the pandemic. So it was a little tough at the beginning. But
Yeah. But I would imagine convenient for your patients who may not be able to have come in to see you in person to
yes,
still buy some formulations and maybe get them
yeah,
online or come pick them up
yeah,
from you.
and both Guard and Shield, tons of it was sold at that time because that there was also all the vaccinations and supporting that process. And although the vaccinations changed, they weren't exactly the same. I felt that that Guard also supported MR, the new type of vaccinations.
Yeah. Yeah, because I would imagine that in looking at the herbs that you have in there, the idea of clearing out heat that's at a deep level of the body, protecting the righteous chi, preventing the pathogen of the adjuvants that are within the vaccine, and still supporting the body to process those, it's still the same idea. So,
Yes.
and in looking at the formulas that you've created, I love the names. They're all very intuitive, right? The
Yeah.
Guard, the Shield. You have 2 fertility formulas, one which is Sprout for the female and the Seed for the male. And so they have really nice names, and then these general formulations that would be good for people who would be needing them. And uh, so I'm wondering now, do patients come in and ask for them from you, or do you still prescribe them? Do they recognize the name of the formulas and say, "Oh, I think I need this because it's got an intuitive name," as opposed to say Yuping Feng San or Lu Wei
Right.
Di Wang Wan?
Yeah. Yeah. No, I have patients who I've put on certain formulas, and they come and say, "Oh, I need some Shield," or I need some Calm or something like that. But generally, our focus on marketing is towards practitioners. So we don't focus too much on business to direct to the public, but more to other practitioners. So in symposium, for example, we have a booth, and a lot of practitioners come um, and learn about the herbs.
And in my learning about your formulations over the past few weeks here before we met, I'm very excited about them because, of course, we all prescribe formulas and we may prescribe granules or tablets, we may prescribe tinctures or raw herbs, but your formulations are quite unique in that they're not an alcohol tincture, but yet they are not I guess we could say the perhaps the liquid packs that someone like Camwo makes, where people would have a large amount of liquid to drink every day. Your formulas are liquid and they are decocted and then condensed. And so the patient takes only a very small amount of the condensed,
A teaspoon.
decocted
Yeah,
liquid. Is that correct?
that's correct. So, by the way, it's interesting. The manufacturer that I work with, I reached him via Alex Tiberi. So Alex Tiberi used his decoctions when I was assisting him at Pacific Center in San Diego in the early 90s. So that's how I get acquainted to him. This company makes private label, so they're not like they don't distribute; they just do private label. And he developed a very interesting way of decocting and concentrating the formulas. So again, it's as you said, it's a water decoction, which the biggest advantage is like the taste is preserved and a lot of the smell. So when you smell the formulas, as opposed to when you smell a tincture, you smell mostly the alcohol. Here you smell a lot of the aromas of the herbs, which I think makes it extremely important. I think it's important, the taste and the smell are an important aspect of herbology, I think.
Yes, they start activating the brain before we've even swallowed the herbs to have a homeostatic change. Let's pause for a moment to extend a big thank you to our sponsor, Handcraft Health. I prescribe a lot of herbal medicine in my practice, and quite frankly, I don't want to spend the overhead keeping hundreds of herbs and supplements on hand. Since the pandemic, I do a lot of telehealth consults and ship patients their prescriptions. Handcraft Health has been my lifesaver. It allows me to have a successful and streamlined practice and saves me money and office space. I am not tech savvy, but the platform is really straightforward for me to write and easy for my patients to pay online and receive their orders at home. It's free for practitioners to open a Handcraft Health account. It's just handcraft.health and only takes a few minutes to sign up. It's one of the easiest choices you'll make to do what you do best. And now, back to our episode.
Exactly. And so I think that what really attracted me to them, and you decocted many times my own home cooking, and I sit in front of the cup and I think of how am I going to be drinking this whole liquid, and it's been a struggle, and I know patients report the same thing. And so I was really excited about this, where you just take a teaspoon and drink some water afterwards. You still get a hit of those tastes and aromas. And but it's not like drinking a whole cup. It's much more doable.
Yeah. And so many other benefits I can imagine for something like travel, to not have to bring so many liquid packs, but still get the benefits of the decoction. Now, there is a small amount of alcohol still in them for preserving, but it's
Correct.
not like a tincture that is based in alcohol.
Correct. I think it's around 20% alcohol, which allows preservation. That's the minimum amount.
Do they have a shelf life? Is there a particular?
Yes, they have about a 2-year shelf life.
It still is. That's good.
Yeah.
Yeah, good for practitioners to be able to keep them on the shelf.
Unrefrigerated, and I believe that if you refrigerate it, you can get a little longer. But of course, you wouldn't want that. You'd want them to be, used fresh, right?
Right. You'd
In
want the herbs
general.
to still have some potency. And for the children's formulas, for the pediatric formulas, they don't have alcohol. They use
No,
glycerin,
we
and then
use
they have a bit of
glycerin. We
flavoring.
use glycerin instead of alcohol, and the advantage of glycerin is that it is sweet. So it gives another sweet aspect or hiding of some of the bitterness in the formulas. It's a little bit hiding, you could still feel it in the background, but it gives a little milder effect to it. Plus, with glycerin, you need a higher percentage of glycerin as a preservative as opposed to alcohol. Therefore, the glycerin ones are a little more diluted, so they're not as potent as the alcohol ones, just mildly so. And so it actually works well because kids, you want formulas to be a little milder in nature, to not overwhelm.
Yes. Yes.
So it
And
worked
so
really well.
they come in 4-ounce and 8-ounce bottles. And how long so you said people would take a teaspoon?
About a teaspoon 2 times a day. So 4-ounce bottle is about 10-day to 2-week supply, and then 8 ounces is double that, of course.
Yeah. Which is
About a year.
very, very reasonable. I actually looked at the price point that you have on your herbs online, and it's more reasonable actually than getting the custom
Vacuum packs.
decoctions, the vacuum bags. Yeah. So
Yes.
that's fascinating. That is wonderful. And so all of your almost all, obviously, except for the fertility ones for the sprout and the seed, but all of the other ones I see do have an adult's version that has the alcohol stabilizer, and then the pediatric version that has the glycerin. So there you have it. You have a group of formulas that are good general formulas for many common,
Right.
well-known ailments or imbalances, and
Yes.
you have them for adults and for children. I love that.
Correct. Yes. Yeah, and I still feel that I need to enlarge it. I have a few formulas that I have in the back of my mind, and that need to be out there, and are important, I think, and hopefully we can get them out soon enough.
Now, for our listeners, some people who are listening may, at some point want to purchase your formulas. Some people may be thinking of, making their own formulations for their own clinic. But what have you found now as an entrepreneur and as someone who has your own product line? Have you found either some benefits to your practice in carrying your own line of products, or I suppose the flip side to that is, as advice to practitioners, what have been the struggles with marketing and carrying your own line of products?
So, first of all, I want to say that dispensing herbs and supplements in your office is a great additional source of income. When I started out practicing, it was all about inventory and keeping inventory. And today, there's much more availability of doing drop ships and ordering for patients. It's a great source of revenue. Just send a prescription, the patient buys it, and you get a cut from it. And so I think it's for a practice, it's really helpful. It's a financially supports the practice. And plus, some of these things happen not when you're even seeing the patient. So it's like a sort of like a source of income that is kind of happening in the background.
Mm, yes.
The other aspect, which is, I think, more important to me, is that some of the patients that I'm seeing have issues that need long-term care. It's not like, oh, I just had a backache yesterday and I need some, it's things that are ongoing. And I find that if the patient is, taking herbs, we get better results. So it improves your outcomes. It improves your outcomes because there's only so many times you can see a patient and give them treatment. While taking the herbs, they do that daily, twice a day, right? So they get a dose of treatment on their own. If you gave them the right formula and it supports them, then that's a perfect combination of support.
Yes. And along with that, that makes me think, as I was looking at the formulas that you've created, many of them, regardless of whether they're, helping with fertility or helping with immune system or helping to calm the mind, you've added in some adaptogenic herbs. I saw in some that, either you've got some, maybe it's a form of ginseng, or maybe it's an adaptogenic mushroom, or some of these herbs that are helping to calm the nervous system and regulate the homeostasis within the body, which speaks to exactly what you're saying, that you're helping on other levels while you may be treating a particular
Exactly.
condition.
Yes. Yes, and I try to do that, and I've also combined from other traditions, which I have some Ayurvedic herbs there and some Western herbs in the seed. I use demiana, which is a Western herb for really supporting the male function. And by the way, seed is a actually quite fantastic formula. I have quite a few patients who take it unrelated to their trying to conceive as sort of like a tonic. So I think seed is an exceptional formula. So I used it mostly for, to support, for the husbands and the men who are taking or participating in that process. But what I found that a lot of patients continue taking it and just like it as a tonic for getting good energy and um, on one hand getting good energy, but it not interfering, being jittery or unsettling in any
Yes.
way.
Maybe for that person who wants to have some increase in their energy and maybe virility, to have some, it sounds like it's a bit of a kidney yang tonic,
It is, yes.
maybe kidney yin as well, to help to
Yeah,
underscore that jing function within the body and the kidneys.
right. That always reminds me of, Mantak Chia?
Yes, yeah.
Mantak Chia. So he always had a saying. He said, when I look at all these sexual advertisements, I say, thank you for the yang energy. That's what he said. He meant that sometimes this kind of sexual energy is not only just sexual, it's part of the yang
Yeah,
aspect of our
yeah.
being.
Fueling our macrocosmic orbit, right?
Yes, exactly.
These sound like really fantastic formulations, and personally, when I saw them, I really loved the form of them. That's something different that you don't see a lot of. That sounds very user friendly and also convenient for the
Right.
practitioners as well. So I love it that you have found something that is a bit different and very convenient. Um, Moving from your entrepreneurship onto your education, which you've been doing, as you said, for the past decade, I wanted to speak a little bit, while we still had some time, about the pediatrics course that you are teaching and some of the work that you've done with pediatrics. And also, you had mentioned neurological issues. And I wanted to touch on this because I think it's important. We see growing concerns with children and young people these days. Some of it may be coming out of the pandemic, and some anxiety and apprehension and neurological dysregulation. Some of it may be due to things in our environment and our foods. And I
Yes.
suppose this would
Yes.
be a whole nother podcast to talk about
Absolutely. Yes.
everything that is disrupting our well-being of our mental health. But I would like to speak a little bit about that. Can you tell me a little bit about the course that you teach, and what the format of that is, and then some of the things that you touch on, including neurological issues and anxiety and ADHD and such?
Okay. I developed the course together with Dr. Stephen Cowan, who is a developmental pediatrician. We've really focused on the issue of development. And I think that that's part of the uniqueness of our course is this idea that development is healing and healing is development. You need to look at how children are developing and what are the interruptions that can happen in our understanding of their constitution as well as the environment and how the environment will affect that constitution. Stephen Cowan also came from his mentor was Ephraim Korngold, who from Between Heaven and Earth,
Yes.
and that idea of looking at five element in a different. It's not like the classical five element acupuncture way of looking at things like the Worsley school. It's a five element herbal um, point of view. It's kind of a little different than what we might see with five element acupuncture, I think. Um, although the main things are there, looking at the constitutions and how will that manifest in a growing child. So we take a long time in the course to work that theory because it allows us to understand how to better approach the individual, the patient that we are dealing with because of their constitution. So, There's certain things that a fire child will benefit from rather than a water child. They'll be very different in how if you understand that, you can adjust your treatment appropriately to allow them to grow and flourish rather than cause issues. So that's a big part of the course. We focus on development and understanding the five types and how to recognize them and how to adjust the activities and the choice of points and choice of herbs that are associated with that way of treating. So that's one thing. Another thing is that we need to understand that sometimes with pediatrics, we need different types of modalities of treatment, meaning that we might not be able to use needles. And sometimes not because of the child, sometimes it's even because of the parent, which is another whole story. We could probably do another podcast on that too. It's like, how do you deal with the parents? But nonetheless, sometimes we need to adjust. So we need to find other ways of treatment and learning different techniques to work on children, not necessarily with needles, or different techniques with needles that can be more gentle and more appropriate. And a big part of that is Shonishin technique, which is a very interesting concept that I think I've been grappling with throughout from the get-go, is that the whole idea of the chi and getting the chi and what does it mean, and do we need a needle or don't we need a needle, and how do you work with that? And I think that's when students learn, there's so much focus on the technique of the needle and how to hold it and so on and so forth, that there's not enough talk about what is chi and how do you channel that, and how do you get, what does it mean to get the chi, right? Get the da chi, right? What does that mean? So with Shonishin, it's all about that. It's about directing your chi and being focused and clear on how you want to affect the chi. And you can do that with different techniques. And even if you want to use different tools, you can affect or create a similar effect or even sometimes stronger effect on the point with the tool, not necessarily with the needle. And I think that is part of treating children that is really important to master.
Yes. And for those of our listeners who may not be familiar with Shonishin, there are small tools that are traditionally used to have an effect on the body, on both the channel and the points, but nothing penetrates the skin.
Correct. Exactly. So, and by the way, there's a whole school of Japanese acupuncture called Toyohari. They use two needles. One is silver, the other one is gold, and it's non-penetrating. It's just you touch the points, and that's how you do the treatment.
Fascinating.
It's connected to the channel called meridian therapy. So Shudo Denmai's school, right, that takes the pulse, understands the imbalances, and corrects it with mostly the five, points of the hands and feet of the yin and yang channels.
As I hear you talk about this, it makes me realize that this is what one can achieve when they have over 30 years of experience, because you've learned from so many different schools and so many different teachers. And now in your level of expertise, you're able to incorporate parts of all of these and see what your clinical experience tells you works or doesn't work or is the most effective, and now be able to present this as an educator to your students. So what a wealth of knowledge you've been able to assimilate.
Yes, it comes with the years, I guess, you know.
Yes, you're now a seasoned master. So yes, you've been able to see so many different techniques and traditions.
My Zev Rosenberg, as I said, one of my teachers, he had this idea, or he talked about this idea that learning Chinese medicine is almost like diving for pearls. You really need to dive deep, and then you only come up with one pearl at a time. But eventually, you'll have some, to keep. So I think
Eventually,
it's
you'll have enough for a necklace, right?
yes, exactly.
Wow.
Yeah.
Well, so thank you for sharing all of this information. We are running to the end of our time. So I'd like to wrap up with a few more things. First of all, thank you for sharing your knowledge and information about formulas and pediatrics and the courses and your experience. For people who want to follow up on any of the things that we've talked about, and we should probably do another podcast at some point in the future to go deeper in some of these areas. But can you tell us your website or
Yes. First of all, since we talked about pediatrics, the jingshenpediatrics.com. That's where we'll have some information about the course. We put our course online through Net of Knowledge and Lhasa OMS in the US. All that information will be in jingshenpediatrics.com. If you're interested about the herbs, my herb line, it's motionherbs.com. And if you're interested to know about my office and our office in Manhattan, it's motioncenter.com. Something that's going to be very exciting is I'm thinking about opening a fellowship program in the office, meaning that we'll hire a fellow. We're thinking about a 2-year commitment, which will involve learning and treating patients at the same time.
wonderful. I'm sure many people would like to follow up on that. And won't that be a wonderful opportunity for someone to get to
Yeah,
have you as a
I think
mentor?
that's something that's missing in our profession. So we graduate from school, and then even we are doctors. But if you look at MDs, then they go to do a fellowship after they finish.
Yeah, because we have CEU requirements, but those are just often another class, and they're very different from hands-on experiential knowledge that you can get from a mentor. So, well, that's very exciting. I have two last questions for you that I always ask at the end of every interview. The first is, can you just share either an interesting fact or maybe you have an interesting hobby, something about yourself that's not related to the medicine at all, but that our listeners might like to know about you?
So, one of the things that I really enjoy is, well, there's really two things, but day to day, it's about gardening. That's something I really like to do. And we've kind of have a vegetable garden that we grow in the summer, and going outside and with my bare feet and going and putting my legs in the earth. I think it's a very powerful thing. And I live outside of Manhattan, so I don't live inside. So there's a lot of nature, and that's something I really enjoy.
Yes,
The
and
other thing
connecting
I
to the
really
earth.
enjoy is traveling. So looking at seeing different cultures and places in the world, and have a long list still to go.
What's one of the next places on your list?
Well, I'm planning a trip to Japan in October. I've already been to Japan, but it's always been something I wanted to go back to. I'm hoping to go back to Nepal again and visit there to do some trekking.
Nice. Yeah, travel is so incredibly important to expand our worlds that we live in. and experience other cultures. And I love it that you're a gardener, because actually that is, of course, connected with herbs and plants and the earth, right? So it all comes full circle as you cultivate your own plants. And my last question for you is, what do you do to stay healthy? You have been practicing for so long. You've had so many teachers throughout your time in this medicine, and you look so young and healthy. What do you do?
First of all, diet and choices of foods, choices of quality of food, and understanding. And I think one of our biggest faults of our society is that we lost the connection to our food. And what I mean is that a lot of people go and you buy something in the supermarket and you have no idea where that came from and how that would affect your body. And so there's a lot of knowledge in Chinese medicine about how to look at foods and what their quality is and how to understand what their growth process will mean to you when you consume it. And I think that's a really important thing to kind of discuss with our patients, because that's at the base of our health, is having a good diet.
Yes.
And and as we say, diet and exercise are the two main things that go together. So the second thing is, of course, making sure that you work your body and in ways that benefit you. And I think there's no one way to go about it, but we need to find the way that works well for us, whether it's Qigong or Tai Chi or yoga or whatever. That's another main thing. And so those are the two things that I think I work on constantly to try to keep myself healthy.
Yes. Connecting to the source of our food and moving your body. That sounds like the two most important things, really. It was an honor to be able to interview and speak with you today.
Thank you.
Go check out his website and his products. And thank you to all of our listeners for being here today. And we'll look forward to having you join us again.
Thank you, Gretchen.
Thank you very much.
Bye-bye.
That's all for today's episode of Elevated Practice. I'd like to express my gratitude to our guests today and always for sharing their wisdom with all our listeners. I hope you were able to take away some insights, practical knowledge, or inspirational ideas that you can apply right away to elevate your own practice. You can find us on Spotify, Apple Podcasts, and YouTube. Don't forget to subscribe and tell your friends and colleagues about Elevated Practice. If you have an idea for an episode or a recommendation for a guest, please respond in the comments or message me, Gretchen Badami, directly through social media. Thank you, and I can't wait for you to hear our next episode.